I was there 2010 in Iraq, and then I was in Afghanistan in 2012 to 13. I was a team leader. I had my own team of 4 guys that I was responsible in training up and making sure that they had what they needed to do for missions.
PTSD is a serious medical illness. We know that. I've dealt with veterans with PTSD for decades, and I have seen the suffering that they have, and how difficult it is for some patients to recover despite multiple treatment efforts.
And all of a sudden it just hit hard with a ton of bricks, where I started seeing things that weren't there. I thought it was just all normal stuff coming back to me, like visuals and memories and everything, but it got real intense. Be on like a patrol all of a sudden, and I'm not on a patrol, I'm in Target. I've had hospital visits, I've had times where I've been blacked out on the ground, and ambulance care guys are just sitting there like trying to figure out what's wrong with me. They don't know what's wrong with me. I couldn't express what it was going on. I just knew it was like about war.
My name is Nanthia Suthana. I'm an associate professor at UCLA, David Geffen School of Medicine. I work in the Department of Psychiatry and Biobehavioral Science. My lab's role in this project is to try to understand the brain signals that predict symptomatic episodes in post-traumatic stress disorder.
My name is JP Langevin. I'm the main neurosurgeon for this team. My area of expertise in neurosurgery is to place neurostimulator in the brain to modify some of the circuitry and improve symptoms. In this particular project, we're targeting post-traumatic stress disorder, and obviously it's for patients who have very severe form of PTSD.
They've tried all sorts of other medications, approaches, therapies that have not worked successfully for them.
Psychotherapy, some meds, it was cognizant therapy, laser light shows, if you will. They cue off lasers and trigger me.
We think that in those patients, the trauma that they were exposed to was so severe that it made almost permanent changes inside the brain. This small device is very smart in that it's not only sending the small electrical current where we want it, but it's continuously sensing or monitoring the brain activity. In a way, the surgery is minimalistic in that we don't make like large opening in the skull, so everything is placed what we call stereotactically, so using frames, very precise.
Oh, well, that wasn't too bad actually. Other than, you go in, shaven head, don't go out without not shaving your head. Just a word of advice. You feel it, but you don't feel it. The only time that you feel is when you're physically doing it, something like this with my hair. I didn't have any pain from after the surgery. I didn't have any pain during or before. It was just, it's there.
We have PTSD patients come in the lab who have these devices implanted in the amygdala. The amygdala is a brain region that is thought to be very important for emotional memories, for threat detection, and processing of emotional experiences. We have a battery of tasks that we use where the patients come into the lab. They view emotional images, some of which may be negative, aversive, or positive and neutral. They also come in and are reminded of their trauma versus pleasant memories. And they also go home and mark events on their device that are symptomatic. So we take all this data in the lab, we analyze it. We found a brain signal in the amygdala that could differentiate between negative aversive experiences versus neutral or positive ones. And we use that signal to determine the timing of the therapy.
The stimulation that is occurring is only affecting the brain when it's needed. I thought that was very exciting.
All in all, the experience has been wonderful. I came in with little hope because it's just the way that things were going in my life, and we put the device in, it got turned on, and then like a couple of days later I started getting these funny little like tingling sensations throughout the body. It's the washing over feeling, it's like you've been run over by water. I had been triggered pretty severely actually at that time, and it all of a sudden just like cloaked over me, and I was fine.
I like this study because it allows us to adapt the treatment for each individual's suffering and problems. What we found is that the first veteran is what we call in remission, meaning he doesn't really have that much of a problem with his PTSD anymore.
I haven't had a dissociated episode in a long time. It's been over a year, I think. That right there in itself is a miracle.
The main goal of the treatment is not to change someone. It's not to make them forget what happened, but it's to allow them to process it, to heal.
So this clinical trial, it's the first time anyone has done anything like this before. In order for this to be successful, we really have to work very closely with these patients, and they become a partner in the research process. This really would not be possible without their commitment.
I know my wife's a lot happier about everything lately. She's working through it.
It really takes a village to actually create the knowledge and experimental treatment potential that we're trying to create. We have disciplines varying from a clinical psychiatrist like me, Dr. Langevin, our neurosurgeon, Dr. Chen, a neurologist. We have psychologists, neuropsychologists, and we have neuroscientists like Dr. Suthana, who has integrated all this combination of technology and human brain function, and engineers. We believe that we have found a tool that is a good option for the most serious suffering patients who haven't been able to get better. We are welcoming men with either combat or non-combat PTSD. Veterans or non-veterans are eligible for enrollment.